Hello and a very warm welcome to the Bruegel Annual Meeting 2021. My name is Guntram Wolf and I'm the director of Bruegel, and I'm very pleased to host this meeting today and in the next 3 days. And I'm very grateful to you as an audience for having joined us for this session of the annual meeting. This is our first session, and being the first, we wanted to discuss the global pandemic and how to move out and overcome today's health crisis and ensure that the funding is available to avoid future pandemics. And before I introduce the topic further and introduce our speakers, I would like to ask you, as the online audience, to go on Slido, which is a website, Slido, and see the first poll that we are asking you to answer. And we will show, before the ministers speak, we will show the results of the polls, so the results of what you think as an audience of how the situation of the pandemic will evolve in the next year. So our first question in the poll is, do you think the world population will be largely vaccinated and the pandemic will be over by the end of 2022? This is, I think, the question, and you can answer it with yes or no, and over to you to really do that on the website. You have to put in the code BAM21 pandemics. So thank you so much for joining, and thank you in particular to our speakers for joining today's session. Of course, the topic, I think, is one of the crucial topics for global health, but also for the global economic recovery. Vaccination campaigns have now really accelerated and have been very fast in many advanced economies. Europe is now ahead. The United States follows closely, and the UK is also following closely. But the vast majority of humanity remains without access to vaccines. And we know from epidemiologists that nobody is safe until everyone is safe. So how do we address the vaccine inequity and ensure that most of the world population is vaccinated by the end of 2022? What domestic measures are needed to contain successive waves of the virus in the meantime? The current pandemic may ultimately be a dress rehearsal for the next pandemic, which can come anytime and is actually more likely to come than it used to be only some decades ago. I'm really pleased to host this panel and to welcome First Minister Sri Mulyani Indrawati. Dr. Sri Mulyani Indrawati is the Minister of Finance of the Republic of Indonesia. She's a specialist of public finance, fiscal policy, and labor economics, has had senior positions at the International Monetary Fund and other institutions, and has more recently also been elected as one of the co-chairs of the 21-23 Coalition of Finance Ministers for Climate Action, which is also a topic that is very dear to Bruegel research. So the minister will speak first, and I'm really happy that she could join us today remotely from Indonesia. Also because Indonesia has recently been hit by a very severe wave of COVID infections, but the numbers have gone down tremendously in the last couple of weeks, and so it has been a very sort of acute situation also in Indonesia, and so we are very pleased to hear from her. Following the minister, we want to hear from Minister Tharman Shanmugaratnam. Minister Tharman is a senior minister of Singapore and has held senior offices in public offices in Singapore for many years, and he has, of course, recently chaired a group which we called a high-level independent panel on pandemic prevention and preparedness. That panel is a panel that came up with proposals how to ensure funding is available to prevent the next pandemic, and was presented, the panel report was presented at the G20 finance ministers meeting in Venice in July. And I had the pleasure of being a member of that panel and contributing to that work under Tharman's leadership. Following Taman's presentation, we will have Amanda Glassman. She's the Executive Vice President and a Senior Fellow at the Center for Global Development and in Washington, and a very experienced public health and economic expert. And she's also been contributing to this G20 group that I just mentioned. And last but not least, Jeremy Farrar. He's a doctor of immunology from the University of Oxford and is currently the director of Wellcome Trust, and has also participated in this G20 report, and has also and Wellcome Trust has also provided financial support for that study. Let me thank all of our speakers for being here with us. And before I give the floor to Minister Sri Mulyani Indrawati, perhaps we can see the results of the poll and see, what our audience think. Will the world be vaccinated by the end of 22? Yes or no? Can we see the results on the screen? So I think what I see here on my computer is on my smartphone is that 71% of our audience thinks that the world will not be vaccinated. So that's the poll, and we will see at the end. We will release a similar poll again and see whether our audience has grown more optimistic or more pessimistic, listening to what we will have to say. So, Minister, thank you so much for joining us. It's a real honor and pleasure to host you today. Over to you. We look forward to your remarks.
Well, thank you so much for this opportunity to be in this annual Bruegel meeting 2021 and discussing a very important issue like the pandemic. We all know that COVID-19 has cost the world very, very dearly. In terms of the economic contraction, minus 3% of GDP, that means around 2.5 trillion US dollar economic losses. If we also consider from the response of many governments of doing the counter-cyclical policy, I think the amount can be even around 11 or above those 11 trillion US dollar. This is how the country tried to fight this pandemic in order for them to be able to protect the people, the population, to stabilize the social implication of the COVID, and also to recover the economic back. Pandemic like COVID-19 is a perfect example of what we call it the global public bad, a global problem without borders. There is no jurisdiction, there is no discrimination. The virus is keep changing. The mutation of this virus is also overwhelm all country, regardless whether they are vaccinated or not. As we can see on this Delta virus, as you mentioned earlier, Indonesia also have the surge of this active COVID, especially in July, that forced us to do a restriction. And that's definitely will cost us in terms of the momentum of recovery that is disrupted because of this Delta virus. So we are dealing with a very complicated, uncertain virus, as well as then the design of the recovery process. So if we are talking about whether we need to do together, I think it's so obvious. But as you mentioned earlier, we are only as strong as the weakest link in this fight against pandemic. It is because the pandemic has no jurisdiction. Fighting pandemic cannot be done by individual country, no matter how powerful, how resourceful, or how innovative. This is require a collaboration. So collaboration and coordination all countries is a necessary, essential, and a must that need to be done. The question is how we can do that. First, I think when we are discussing about pandemic, the first necessary condition for each country to have a good, reliable national health system. And this is not an easy objective or goals, because country need to have not only resources like financial resources. Some country like Indonesia mandating 5% minimum of your the budget spending for health, but not necessarily guaranteeing that the building the national health system is easy. That will depend on the capacity of those country. The national health system will also depend on whether you are having a good quality of health worker with a good incentive, health facility, especially primary health care that is going to be able to cover or providing access for all your population. And of course, dealing with pharmaceutical industries as well as how to attract public private in financing these health services for a country. But there are a lot of knowledge can be actually learned from many countries regarding how to build the good and sound health services in a country. But this is really a requirement for all of us to be able to fight the pandemic. Because as I mentioned earlier, we are only as strong as the weakest link in this fight against pandemic. That means no country should be exceptional in their importance to build the good and sound national health system. Now, the second one, because we are dealing with the global public bad, then the global collaboration is really important. This case, the role of multilateral institution, for example, like WHO, World Bank, is going to be very, very critical. They have the knowledge, they have the capacity building in order for them to be able to provide technical assistance for many countries, especially developing and emerging country. But sometimes even advanced country not necessarily have a good national health system. And of course, for institutions like the World Bank, they have financing resources in order for them to be able to provide support. But we definitely see from this pandemic that the resources required or needed to fight this pandemic is not really there. It's not adequate. Although during this very, very early pandemic, there are quite a lot of support, immediately response from the multilateral institution that they change their program and lending facility in order for all country, especially developing country, have the ability to access for the vaccine, but that is not going to be adequate considering the scale of the challenge that we are facing. There is also a need for us when we talk about the collaboration globally is how the early warning system of the pandemic can be established. And this is very tricky because you are dealing with the sovereign jurisdiction vis-a-vis the global need for us to be able to share the information so that the early containment can be done. There is always a tendency and tense relationship between the sovereignty versus the global governance that need to be established, whether this is in the form of resources, whether this is in the form of governance or decision making process, or whether this is in the form of information sharing. But failure to do that will provide a catastrophic damage as we can see from this pandemic COVID-19. I think this phenomena is going to be similar for the climate change. That's why when you mentioned about the discussion of the financing for the climate change, this is also one of the critical points. Now, let's discuss about the financing for this global commons as pandemic is an example, perfect example of this global common, which require a global response. Financing for the global commons, I think I really support and also appreciate the work of the high level international independent panel that providing the review as well as the recommendation regarding how the world should establish a mechanism, especially on the financing side, that will then create an ability for country or world to be able to respond with this global common threat like pandemic. What is being presented on this study, I think resonate very strongly with the need of the country to collaborate and to coordinate. The question first is, who should contribute to this kind of global common objective? Usually, we are going to talk about the common but differentiated responsibility. But when you talk about health, this is all related to the concern as well as the objective of each country. The problem also, of course, that each country have a different fiscal situation. And that's why the question regarding how we are going to be able to mobilize coming from both sovereign contribution or private contribution is going to be very critical. But this is exactly how we are going to deal with establishing financing at the global level that will guarantee the first quick response so that any threat of the pandemic can be contained as early as possible so the damage can be minimized. Second one, when we are talking about sources of financing, then we are dealing with the governance issue. What kind of governance that need to be established so that government or country willing to contribute and they are going to stick with this contribution? What kind of decision making process and how the benefit can be derived from this kind of resource? I think that will be a very critical in order for us to be able to deal with this kind of threat, which is threatening all people and country regardless their location or their income level or any attribute to this country. So this is going to be one of the most important challenge, that is financing and the governance that will be able to deploy when we are really see the need and the necessary to work together. Now, for Indonesia, I would like to touch on my last part of my presentation this afternoon. Indonesia, from the very beginning, knows that this pandemic gives us no option. We are fortunately, as a democratic system, we have the support and a good communication with our parliament, but the need to respond very, very rapidly, but at the same time accountable and flexible with our fiscal policy is so obvious. We change our budget immediately in order for us to be able to make sure that on the health area, there is no reason for any measure can and should be done in order for us to be able to contain the pandemic at the very minimum level. I think so far Indonesia is fare relatively better if you measure in terms of the number with the positive rate. Although we continue have to improve the testing, tracing, and treatment, we also among a few countries who secure the access of vaccine because there is no what I call it financial constraint. We provide the whole support for the Ministry of Health in order for them to be able to deal with this pandemic. But sometimes a country as big as Indonesia cannot deal with this kind of threat of pandemic by the line ministry like Ministry of Health. Because of the speed of the COVID, we have to deploy the extraordinary measure. We even use the police forces. We even use the military forces. We even use the non-traditional all structure in order for us to be able to reach at the level of village and the people. When we are arranging what we call it the restriction movement, this cannot be done as a what across the board lockdown because it will kill the economy and it will definitely create a social tension which is untenable. So for the Indonesia, really finding the right balance between preventing the COVID or the virus to be transmitted without killing the economic activity is really the most important and the most complex decision making process. I think Indonesia relatively now calibrating and recalibrating all the approach. And if we look in terms of the result, relatively Indonesia fared better if you compare with the country with the size of population, geographic, or even income level. That's said that we are not complacent what we've already achieved. Like Delta virus, we really have to fight very hard. And that costs in terms of, as I said, earlier, the momentum of the recovery has been compromised. And of course, people entering the second year of this COVID, their endurance as well as fatigue and patience is going to be very critical. So we really need to make sure that we have to be able to overcome this pandemic. So I would like to stop here. Again, I think this is going to be one of the most important challenges that we need to address together. Thank you so much.
Thank you so much, Minister. And I think these were really excellent points. You touched on an enormous number of topics that resonate very much with what we discussed and thought about also in our high-level independent panel. The common but differentiated responsibilities, how to fund the global commons, but also the need to collaborate closely between finance ministries and health ministries was a very important thread and topic of our work in this panel. Let me hand over the floor to Tarman, Senior Minister Tarman, for his intervention. Tarman, over to you.
Thanks, Guntram, and very happy to follow after Minister Sri Mulyani, and looking forward to Indonesia's leadership as G20 president for 2022, and Ibu Sri Mulyani's chairing of the finance track, which will in fact be working very closely with the health track of the G20 over the next year. And thanks too to Guntram and Bruegel for your very active contributions to the G20 panel, and to Amanda, who is a key member of the project team, and to Jeremy, who is an advisor and one of the global health leaders whom we listen to very carefully. If I could just start by saying that we are nowhere near the end of COVID, and the most urgent priority globally today is to vaccinate the majority of the world's population as soon as possible. It can be done. The multilateral leaders task force, comprising the IMF, World Bank, WHO, and WTO, have laid out the basic elements of what needs to be done, both with regard to vaccine supply, delivery systems, and I have to emphasize delivery systems because it's not just supplying vaccines to countries, but it's actually transporting, setting up logistics systems, and having in place the community level provisions to actually get vaccines into the arms of the population. And it's also about financing to make sure that nations are able to procure vaccines and are not held up in any way by a lack of finance. This is the most urgent priority everywhere in the world, not just in the parts of the world which currently have a very low vaccination rate, and Africa is actually a startling case where you still have less than 3 or 4 percentage points of the population, 3 or 4% of the population having been vaccinated. But it affects everyone in the world, because the longer that COVID rages on, the more the scope for variants to emerge and to set us back everywhere, and increase the economic costs, quite apart from the human costs of this COVID disaster. Second, of course, we know that COVID is, as Guntram suggested in his opening remarks, not a one-off. It may very well be a dry run for a much more lethal pandemic. And scientists have told us what's been on the cards for some time. We are in an age of pandemics, and we're going to see renewed outbreaks, many of them major and global scale, in the years to come. They'll happen more frequently, they'll spread more rapidly, and they may be more devastating than COVID-19. It could come anytime. It could come in 10 years' time, the next pandemic, or it could come next year. So we cannot lose any time in preparing for future pandemics. And what Sri Mulyani said about the need to think in collective terms, quite apart from getting our national defenses in order, thinking in collective terms has to be regarded as an urgent priority for the international community. And it requires a new way of thinking about international cooperation, moving away from thinking of support for global health security in terms of foreign aid to other countries. That foreign aid mindset is entirely appropriate if you're helping countries develop stronger primary healthcare systems for their own needs. But here we're talking about pandemic risks, and pandemic risks can only be tackled by investing in global public goods. And these are the capacities and facilities and manpower at the national, regional, and global level that everyone benefits from. Essentially, if we don't build up, as Sri Mulyani was saying, the early warning systems, if we don't build up capacities, national, regional, and global, to detect pandemics early, to prevent them from spreading, and to run them to the ground as quickly as possible once you have an outbreak, if you're unable to do that, every country suffers. So this is a case of not just solidarity, but a case of national interest everywhere. And we have to shift our thinking about financing of global healthcare security away from a ODA or foreign aid mindset towards thinking about it as collective investments in global public goods. It requires fundamentally that we strengthen multilateralism. Sri Mulyani spoke, of course, about the foundation of the system, which is national health systems that need greater resilience. And we are around the world still quite some distance away from meeting the WHO's international health regulations, the capacities that all our countries need. So national health systems are, of course, the foundation of pandemic preparedness. But we have to strengthen multilateralism, because otherwise we're not going to be able to invest in global public goods on the scale required to prevent the next pandemic. And this means, firstly, supporting the WHO and the global health institutions themselves. And that includes both the WHO as well as the One Health partners, the FAO, the OIE, and UNEP, because One Health, that tackling that interface between animal and human populations is critical to preventing future pandemics. But basically, we have to strengthen the multilateral health organizations, and the WHO as a key, as the universal regulator, normative and standard setter, and key pillar of response to pandemics, needs more secure and predictable finances. Secondly, we have, as Sri Mulyani was saying, got to make much better use of the international financial institutions, the World Bank and the other MDBs and the IMF. They're unique institutions because they are able to multiply resources. They're able to catalyze domestic investments by national governments in preparedness, and they're able to catalyze private sector investments. So they're unique institutions, and we need to use them more. If we were creating these institutions anew, the way they were created more than 70 years ago in the Bretton Woods Agreement, we would face up to the fact that the largest challenges facing the world and facing individual countries are in the global commons, the climate crisis and recurring pandemic crises. These are the two largest challenges that are facing us. And it would mean that we have to build global public goods for resilience against climate change and for pandemic security, build global public goods into the core mandates of these international financial institutions. And shareholders have to be willing to support this repurposing of the institutions by making timely replenishments of their resources, so that this greater emphasis on global public goods is not at the expense of poverty reduction and shared prosperity. Third, besides strengthening the individual institutions and besides making better use of the international financial institutions, we do need a new global mechanism. The current global health security system is fragmented. It comprises many institutions, and funding is siloed. It is siloed both in the sense that it's reliant on discretionary bilateral funding in the main and some philanthropic funding. It's also siloed in terms of the way the monies are used. because these are institutions that were set up, apart from the WHO, they were set up to deal with specific diseases or specific interventions like vaccines or diagnostics or drugs and treatments. So it is a siloed landscape. And the fundraising mechanisms are siloed on the way in. The monies come in on a siloed basis and the monies flow out on a siloed basis. And the result is an inefficient and greatly inadequate system of funding for global health security. And the way to overcome this is to set up a new global mechanism for governance of financing and for mobilization of financing for pandemic security. How to do it without adding complexity and adding to the fragmentation of the system is an important challenge. And it can be done because we can set up a global mechanism to oversee the financing of health security in ways that complements and in fact strengthens global health governance, which is under the WHO and the World Health Assembly. These have to be complementary mechanisms, and that can be done. Second, in setting up a new fund, which is critically necessary to overcome a siloed landscape, we have to make sure that this new fund is not a new operational institution where it is dealing directly with governments or projects on the ground, but it's really a fund of funds that supports the existing institutions and adds synergies between the existing institutions. So this, in fact, can be done. We can overcome a siloed, fragmented landscape rather than add to the fragmentation of the current system. I just want to conclude by saying that the investments required sound large compared to what the world has been investing before. The G20 panel has talked about a new fund that requires at least $10 billion a year. That sounds like a very large sum. $10 billion, if spread out over countries on a fair and equitable basis, as Sri Mulyani was saying, amounts to about 1,000 of the annual government budgets of each country, about 0.1% of the annual government budgets. And it's an even smaller fraction of their GDPs. And in return for this collective investment, we're going to be able to save the monumental costs of future pandemics. The cost of a pandemic is about 700 times the cost of the annual additional international investment required. So there's really no higher social return for a collective investment that we have to make. And it would be myopic to defer these, setting up these global mechanisms, because we'll pay for it very heavily once again in the next pandemic.
Thank you so much, Tarman. And indeed, I think, as you rightly put it, the cost for preventing pandemics is in the billions. We came up with a number of roughly 10 billion per year, but the cost of a pandemic is literally in the trillions. So it's really a very, very good social investment for the world to invest into pandemic prevention and preparedness, and the sums are at the end of the day quite small compared to what you get out of it. Let's move on to Amanda. Amanda, please, the floor is yours.
Thanks very much, Guntram, for the privilege of sharing this panel with the co-panelists. I just want to say two things about some key gaps in pandemic preparedness and response that need to be funded now to respond to COVID, and that will also help us face future pandemic risks that, as Minister Tharman said, could come in 10 years or could come next year. So the first key gap that the panel that we worked on identified was around surveillance and early response, particularly at the country level. You know, when we look at sub-Saharan Africa, 40% of deaths go totally unrecorded. We learned about deaths in real time from cemeteries and funeral parlors this time, not from official data. This really is a huge challenge for us. Genomic surveillance, which is so vital to be able to track emerging variants, and that will be necessary to understand if it's Ebola, if it's Marburg, whatever it might be in terms of a novel pathogen. Such small samples are being tested at this time, and particularly in sub-Saharan Africa and Latin America. In Uganda, for example, 25 25 samples. That's the sort of level that we're at now. We are at an artisan level when we need to be fighting a global battle. So I think that gives you a sense of the need that is there. And it's tough because low and middle income countries face huge opportunity costs for the use of their very scarce resources to spend on issues like surveillance and death registration. In every hospital, there's many people demanding care. Even basic things like diabetes are not fully diagnosed and treated. So it's really necessary that international financing come in to complement these domestic investments because, as Minister Tharman said, and as Minister Mulyani put it, this is not something that only benefits the country in which these activities happen, but they benefit the entire world by preventing spread. Another example of a key gap is around research and development and manufacturing of medical countermeasures. We need now to think about a or coronavirus vaccine, for example. That's something that serves this response and it will serve future coronavirus pandemic risks. There are other examples of this. The other key thing I think that this panel talked about, which is important, is about how we should fund some of these activities. We've talked about the need to be sufficient. We're underspending now. Even in the OECD, we're spending less than 2% on public health of our public budgets. And that includes things like smoking cessation, okay? Not even speaking about epidemiological surveillance and infectious disease control. Honestly, it's a joke. We need to improve. In low and middle income countries, we're not even tracking this expenditure. The amount of aid spent is marginal. So we need to fund sufficiently. But we also need to fund propositively. We need to fund with the intention to meet minimum standards. It's not enough to fund to finance training courses, capacity building in general, institutional support. Yes, to all of that, but with results in terms of the level of surveillance and preparedness and response that we want to reach. And that has already been agreed internationally, so it's entirely feasible. The third way we need to fund is in an early way, in a flexible way, and in a way that takes risks. We know when we invest in an R&D portfolio, as we've seen in the excellent case of CEPI that Dr. Farr had such a huge role in setting up, some bets will fail. Some bets take longer, and speed is entirely of the essence here. I think, when you talk to the leaders of the response now, they said if they had an additional 100 million, they could have set up a new Moderna manufacturing facility that could only supply the developing world, and we would be in a totally different place now in terms of the pandemic. I think we need to acknowledge we've made mistakes, but we can correct that with future financing. So I'll stop there and turn it over to Dr. Farr. Thank you.
Thank you so much, Amanda. And well, Jeremy, last but not least, the floor is yours. And I'm already sorry for the audience that we've been sort of overrunning. But if you want to ask a question, you still have a chance to go on Slido and type a question. I'll try to ask 2 or 3 questions after Jeremy's intervention. Jeremy, thanks so much for joining. The floor is yours.
Thanks very much. I can be very quick to leave more time for questions because many of the comments have already been made by excellent comments already. But I'd like to just drag us back to this pandemic in a sense. I'm afraid to say that I'm with the 71% at the start. We're closer to the start of this pandemic than the end. There will be further waves, I'm afraid. And as Tharman said earlier, we are living in a pandemic era. Yes, it could be next year, it could be tomorrow. We cannot predict when the next pandemic will come to us. But if we look back in the last 20 years, frankly, every 2 or 3 years, we've had a major national or regional crisis that has challenged countries and regions, going back to an outbreak in Malaysia of a virus called Nipah in 1999. And the features of this are all features of the 21st century. Ecological change, environment change, urbanization, trade and travel, and frankly, geopolitics. And we cannot ignore the discussions of geopolitics if we're going to take the fine words that we all do believe in. We have to include the political structures that exist and the tensions that do exist, east-west, north-south, that has actually been exaggerated during the pandemic. And pandemics are no longer should be considered a health issue on their own. Pandemics, of course, predominantly affect people's health, but they don't just affect the health of COVID, for instance. They affect the whole of health, cancer therapy, diabetic care, are all affected by our ability to control pandemics. And then, of course, we have the economic disruption, the opportunity loss through educational disruption, trade and travel, and trust in the governed and the governing, debt relief, and as I keep coming back to geopolitics. I also think we're living now in a new era of politics where your domestic agenda and your international agenda are absolutely intricately linked. And sometimes, as with COVID, that will pull you in different directions. Where your domestic political agenda may be, for instance, to offer vaccines to your population before anybody else. But your international commitment and actually your enlightened self-interest would be to offer those vaccines around the world as well. And so you've got a domestic pull in one direction and an international pull in a different direction. And if you take that pandemic as the example of that, the truth is that that is also true of climate change. It's true of energy and clean water access. It's true of many, many of the issues that we face in the 21st century. And I don't think our domestic politics or our international financial and other multilateral institutions have really grasped this challenge that we're caught between these domestic and international tensions. And then finally, on what needs to be done, which has been very well articulated already, surveillance is critical, sharing of the information is critical. But if we don't then share the benefits of sharing that, then we won't persuade anybody to share anything. And that is the greatest risk of all at the moment, that as we do not make vaccines, oxygen, PPE, therapeutics tests available globally in an equitable way, where are the incentives to share the information through surveillance? Unless we correct this vaccine inequity and other inequities that we're living through at the moment, then I don't believe we can bring the world together to develop the sort of surveillance systems, to share the sort of information that has to be shared, and to actually work together at a global level. So this is no longer just a health issue. Yes, it's a financial issue. Yes, it's a governance issue, but we cannot exclude the politics from this as well. Oh, back to you, Good.
Thank you, Jeremy. And since you mentioned the issue of fair and equitable access to vaccines, let me throw the first question at you, which is by Mia Hoffman. She's asking, well, fair global vaccine distribution failed so far. What did the global community learn from this, and how can initiatives like COVAX be designed better in the future? So I'll ask one question to each of you, and also for our audience, there is a poll again to see whether you've grown more optimistic or more pessimistic in the course of this session. So please also answer the poll, and I'll show the poll at the end. Jeremy, what do we learn from COVAX?
It's a good question about COVAX, because it's actually a fundamental truth, and that is the agencies and organizations you have going into a pandemic will be your ability to respond in a pandemic. If you try and establish these structures of governance, trust, relationships in a pandemic, you'll always be too slow and you'll fail. So what you have at the start going into it will determine your ability to come out of it. And COVAX, the ACT Accelerator, didn't exist before COVID, was cobbled together in the summer of 2020. And one of the lessons critically for the future is that those sorts of structures are set up properly, sustainably, with the proper financing, as Minister Tarman said, so that they can be sustained over the long term. And secondly, with the countermeasures, vaccines, therapies, tests, whatever, we've got to have a better distributed manufacturing capacity at a global level. So not all of these countermeasures are produced in only a very small number of countries. They have to be more distributed and therefore more democratic and more equitably distributed around the world.
So Sri Mulyani, I have a question for you from the audience, which is about global inequality, which has increased due to the pandemic, and I think is now a crucial issue, how to address increases in global inequality, both across countries but within countries. As a finance minister of a large democracy in Asia, what's your take on global inequalities and how to address them?
Well, this pandemic is definitely will worsen the inequality, because for some people, and especially if there is no regulatory framework and there is no also guarantee for people to have an access of the vaccine, then you can really see that those who have the access of the vaccine is the rich, whether this is rich country or rich people. And that will not serve well for this kind of problem, because as I said, the weakest link is going to be the one that defines the strength of our ability to deal with this pandemic. How we are going to address this issue of inequality? I think as a finance minister, of course, there is an instrument, for example, like taxation, in which you can dealing with the tax at the individual level. But certainly also at the same time, when you talk and discuss about the taxation as a way to redistribute in this case, the question about the ability to enforce the taxation within the one jurisdiction is going to be also critical. At the same time, when we are still having a jurisdiction that can provide a tax haven for those who can evade the tax, that is going to be very critical of the effectiveness for any country to do the tax effectiveness. The second one is, I think, for many countries learn a lot. If you, especially in a country that can provide an equal opportunity and equal access, especially basic services like health and education, because sometimes the design of your social protection is not providing an equal guarantee opportunity for all population, the member of population, especially for the basic services like health and education. I think these two very important element of people to be able to have an access of health and education will at least guarantee them to be able to then participate in the economic activity in a more productive way. And that by design is going to also reduce the inequality. So there is also the element of revenue like taxation, but also the element of design of spending and also design of your social policy, which is very critical. And I have to say also in this case, inequality can be becoming even acute when you have the political system that creating an oligarchy in your economy. I think this is one of the most critical in terms of democracy in the politics, whether that will creating a democracy in the economy, as well as the equal opportunity for all the population to be able to develop themselves, so that they are going to be able to then working, or in this case contributing in the society. I think that is what is the most important. Digital technology can help, but that's also creating inequality, digital divide. So there are so many in this case in the public policy point of view, you are dealing with the inequality. You can always do the policy mix in order for you to be able to narrowing the inequality. But we should not forget the fundamental that create inequality, whether this is political structure or the competition which is not fair, or at the same time also the distortion that is created by any policy or structural issue.
Thank you very much. Taman, we have a few questions on global trust. Vivian Linson is asking, well, a world crisis such as COVID requires global collaboration, and that at the end requires global trust. How shall you recover, and how can we recover global trust? And related to that, there's a question on, what is the role of regional organizations? Have they gained in this pandemic? Can they play a bigger role? And last but not least, also quite related to this, how do we prevent protectionism? Because protectionism, of course, has been very undermining in the global health response. And I have to say, as someone now speaking here from Brussels, I think we should also say quite openly that the EU has exported actually a lot of its vaccine production and has managed to keep its borders open. So how do we ensure that global supply chain and global protectionism can be avoided and global supply chains can remain open? Taman, perhaps you can give us a bit this multilateral global perspective, because that you emphasized that very much also in your speech.
I think both the sharp deterioration in global trust that we've seen over the last year and a half, as well as the protectionist measures that have been taken that have impeded the supply of both raw materials as well as finished vaccines to the rest of the world, come out of a fundamental problem, which is that we do not have a system to adequately supply on a global scale within a short time the vaccines, or in future the therapeutics, and even PPEs that are necessary for the world. We just don't have that global supply chain in place. It had to be invented in the middle of a pandemic. And as Jeremy says, when you start in the middle of a pandemic, it takes a long time. Fundamentally, this is a new public policy challenge. We're not going to be able to change nation-state democracies in either the rich world or the rest of the world. Nation-state democracies will give extra attention to their own people everywhere in the world. But we do want to tackle the pandemic everywhere because it's in everyone's interests. How do we reconcile these two objectives, or how do we avoid this tension leading to what we saw in the last year and a half, which is a huge inequality in access to supply? The only way to do it is to build up the global supply capacity in advance of a pandemic, not in the middle of a pandemic. And that means having ever-ready manufacturing capacity for multiple vaccine candidates before a pandemic. The private sector does not have a commercial incentive to put in place such capacity. They don't know which vaccine is going to be successful, in other words, going to get regulatory approval in a pandemic, and they won't invest in advance in the multiple candidates that need to be invested in advance of a pandemic. So it requires public investment together with the private sector so that we have ever-ready manufacturing capacity, if you like, so that we have an oversupply of capacity in advance of a pandemic, because that's the only way we're going to reconcile this tension between what nation-state democracies will do and what's in the global interest and in all nations' interest together. We need greater global supply. Secondly, I think we also have to invest in new manufacturing technologies themselves, lower cost modular technologies that will allow for more interchangeable manufacturing capacities, so that if one vaccine isn't going to work out, you can very quickly repurpose it to be able to manufacture the vaccine that is successful in a particular pandemic, or a drug or therapeutic that's going to be successful. We currently have a very clunky system. It takes a long time to repurpose existing facilities from one vaccine to another, or from a vaccine to a drug or therapeutic. It takes a very long time. Thirdly, we need a better redistribution. We need a better regional distribution of manufacturing capacity around the world, so as to be able to be more resilient in the face of protectionist measures. And that means both the production of raw materials, as well as the production of finished vaccines and treatments. So it's a major new public policy challenge. COVID was a very bad example of how things shouldn't work, but we just didn't have the manufacturing capacity in place. And the lesson for this is, it's not about blaming the private sector, it's about having public-private investments ahead of time. Developing countries will not be able to afford this on their own. It requires a global capacity and global financing that will be in everyone's interests. That's the only way we're going to bring trust back. That's the only way we're going to be able to reconcile nation-state democracies with the global public good that all nations benefit from.
Thank you so much, Taman. And Amanda, the last question goes to you by Rachel Hammonds. She is asking, well, the pandemic has shown that we cannot divorce global health security from building health systems. how do we include universal health care in the health security conversation? And perhaps related to that, a question by someone anonymous on, what is your assessment of whether global health authorities are still in a crisis management phase, or are they already starting to be forward-looking and have a prevention attitude vis-a-vis these health challenges? Amanda, please.
Only the easy questions. Thank you. Universal health coverage is about access to a defined set of health benefits that are free at point of service. So, and access has certainly mattered. Countries that had less access to health services meant people sought care later for COVID-19. Countries that had lab services that you had to pay for were slower to begin to detect cases. And then when you sought care, maybe you would become impoverished because of the huge bills that you would face. So, having universal health coverage and an adequate health system helps with pandemic response, and it helps with inequality and coping with health shocks, as Minister Mulyani set out. Global health security is a subset, let's say, of universal health coverage, but it in itself is a set of goals that are somewhat different from what we would set out for the health system as a whole, right? Which is to deal with the largest routine burden of disease, making sure people have access, et cetera. So I would see them as totally complementary, but slightly different. Countries need to do both. I think the issue is that in general, countries have moved ahead with universal health coverage schemes, obviously need more financing, need more attention, and will continue to receive that. But in general, things like epidemiological surveillance, public health institutes, centers for disease control have been relatively underfinanced and paid little attention. So that is the piece of this puzzle that we really need to strengthen in addition to UHC. On the question of crisis management versus recovery, I think it's really notable that many of the global institutions, especially the international financial institutions, actually were talking about recovery much earlier in the pandemic than you would have thought. We watched from the Center for Global Development, the multilateral development banks, and they were all focused on recovery as if the pandemic would be something that could end quickly. And I think now actually we have most of the leadership now squarely focused on a protracted crisis and getting vaccinations to all. Thinking about the next pandemic, I think the way that we have to think about it is that what we do now should work for COVID, and it should work for the next pandemic threat. We're going to have to build manufacturing capacity now. We're going to have to invest in surveillance now. That will help with COVID, and it will help with the next time. So I don't view those as either or, it's both. Thanks.
Thank you so much. I'm afraid the 1 hour goes really, really fast when you have such a stellar panel with such excellent remarks and excellent speakers. But I do want to say that it has made our audience more pessimistic than they were at the beginning of this session, which I think highlights really the huge challenge that is ahead and the importance to prioritize this global health challenge in the fall, in the policy fall, but also, I would say, in the coming years. 93% of our audience thinks the pandemic will not be over by the end of 2022. So pretty bad picture, and really highlighting that urgently we need to do more policy action. And I just want to thank all of our panelists for their contribution, and also really thank Taman, Jeremy, and Amanda for the great collaboration we've had in the last couple of months on preparing this report for the G20 ministers. I think this conversation also today, thanks to you, Minister from Indonesia, Sri Mulyani, has again highlighted how important this whole conversation is, and how important it is that we accelerate and step up as a global community to fight not only this pandemic, but also future pandemics. The returns will be huge. The cost is not so big at the end of the day. It really doesn't take that much, but it does take political will, and it takes political leadership. and that's what we will need in the fall. And I hope that the G20 process will lead to some tangible results. Thank you all for participating, and it's been a very, very pleasant and important first panel. Thank you all, and until our next panel in a few hours, where we will discuss actually the European recovery and have a perspective from Spain, the Minister of Finance from Spain, Nadia Calvino. Thank you so much, and until then, bye-bye.